Hello, everyone. This is Dr. Mike Chua, physical therapist. And yes, I am here at iMind here in Jackson, Tennessee, where we're going to interview Dr. Anna Cook and, of course, Aaron here. We're going to ask them some questions about what's going on in this open house here today in a minute. Okay, we'll be back. Hello, everyone. This is Dr. Mike Chua again. We are here at iMind here at Jackson, Tennessee, and we are interviewing Ms. Dr. Anna Cook and Aaron here. We're just here doing the open house. We're going to ask her what do they do here in iMind. Why iMind, right? So again, if you're watching live, comment live, watching on a replay, comment replay. We are streaming this in our amazing Alzheimer's and dementia support group and also in our podcast. You know, if you're watching our podcast, please type in podcast. If you're watching on YouTube, type in YouTube. Obviously, Facebook, in our Facebook group. So why iMind? Let's ask Dr. Anna first. Dr. Anna, could you please tell us who you are? What do you really do here in iMind, the mental health and wellness?
So as far as the name goes, basically, whenever we were trying to pick a name for the clinic, I wanted it to be something that kind of represented like newer technology, like I don't know, like iPhone, Apple, like, you know.
I was thinking about that.
Yes. Mm-hmm. So that's pretty much where the name came from.
Amazing.
And so I am a psychiatric nurse practitioner. Mm-hmm. So that just means that I'm a nurse practitioner that has gone through specialized training. I went to Vanderbilt and to get training specifically to specialize in mental health.
Wow.
So I do a combination of medication management and some talk therapy, but my specialty really is like diagnosing the medication.
Did you hear that, ladies and gentlemen? A lot of us here in the group, we talk about, you know, the different process or the what you call the Kubler-Ross stages of grief. And we go through these different stages: the denial, the anger, the bargaining, and the depression stage. And there are three things that you need to do in order for you to be able to move on to the next stage, which is called acceptance. Am I correct, Ms. Ann?
Yep.
And three things that you need to do to move on. First is medication management. Okay, it's just three things. It's just like a chair or a stool. It's not going to stand up. If you take off one leg, it's going to fall. So one part is the medication management. The second part, that you need to do when you're in that depression or any kind of mental illness or mental issue, you need to do three things. So first is medication management. Second is coaching and counseling. You need to have a coach. We're going to ask this gentleman over here later. Coaching and counseling. You know what's the number three thing? Is therapeutic activities. That's why all three disciplines are actually like a stool. Three things: your medication management, coaching and counseling, and obviously therapeutic exercise or activities in order for you to move on to the next level. And that's what Miss Ann is here, Dr. Ann is here for, to take care of your medication management. So Miss Ann, what are the different cases or diagnoses that you see here in your clinic?
So we see a variety of different diagnoses: major depression, anxiety, ADD, bipolar disorder, schizophrenia, acute grief disorders sometimes, PTSD, people that have experienced trauma. So we really treat all of an umbrella of different mental health disorders. Yes.
Did you hear that, ladies and gentlemen? She treats, depression, anxiety, I forgot what she just said, but PTSD. But in order for you to achieve the recovery and getting better in that acceptance stage, again, the three things: medication management, coaching and counseling, and therapeutic activities. So that's the goal there. You need to do that first step, medication management. And that's what she's here for here in iMind. If you have all those diagnoses, go here, call their numbers. We're gonna show it up later, and then we'll put up the website, the number, and everything here. The next guy that we're gonna interview or ask is Mr. Aaron. Mr. Aaron, are you there?
I'm here.
All right. So as if you were on Zoom, right? But we're just actually live.
Okay.
What do you do here specifically in iMind?
So I'm a mental health therapist. I'm a licensed clinical social worker, and I work with all the populations that she just kind of mentioned on, like you said, the counseling and coaching and trying to find therapeutic exercises that are realistic and achievable for people in their regular real lives.
Mm.
Yeah.
So what are the different cases that you also see aside from Miss Ann that mentioned?
Yeah, so we see a lot of what I work with is therapy for trauma, grief, counseling, traumatic events, working through some childhood issues that are still popping up even into adulthood, separation issues and things like that. We recently hired another therapist that focuses a little more on working with children. I work mainly with adults, but with folks from say 5 to 99 or wherever we end up at.
Wow.
A lot of what we also work on is some aging issues, like you mentioned, Alzheimer's, working with caregivers and or patients.
Funny you mentioned about caregivers. In the Alzheimer's and dementia support group that we have, I mean, the members in that Facebook group, they're not actually actual patients, they're caregivers.
Yeah.
And they also undergo some sort of depression.
Yeah.
Caregiving, you need to take care of yourself. You cannot give what you do not have. All right. That's why it's called caregiving. So you got to take care of yourself too. So any special tip, two of you, for caregivers out there who wants to better their iMind, Miss Ann?
I would say,
I like this rolling chairs.
I see that. I would say probably what I would recommend the most is really making sure that you are engaged in self-care. Whenever you're a caregiver, especially caring for somebody that has Alzheimer's, that definitely can be a very challenging disorder to deal with. And so if you aren't taking care of yourself, then it's going to be very difficult for you to take care of anybody else.
Did you hear that, ladies and gentlemen? Self-care. It's very important. Self-care is not selfish, ladies and gentlemen. You got to take care of yourself in order for you to be able to take care of other people too. Anybody out there who's reading the plane lately? I know we got all this COVID, but when you ride a plane, right? Is that how you say it? Ride a plane, or the first thing that the flight attendant will say when that oxygen comes down, you take care of yourself first. Put that oxygen mask first before you could help your son or your daughter or that person right beside you. And same thing when you're taking care of someone else, like what Miss Ann was talking about. Self-care. You got to take care of yourself, ladies and gentlemen. How about you, Ms. Aaron? Any special tips for our caregivers out there?
I talk a lot about the oxygen mask thing. It's real. My son is 5 and he can't put an oxygen mask on me if I'm unconscious. It just doesn't work. So taking care of yourself, and I think finding things that are realistic and achievable that you can actually complete. Caretaking for somebody with Alzheimer's or dementia doesn't have a lot of win conditions. There's not a lot of successful things that you can do that are going to completely alleviate that illness or anything like that. So finding things, projects, hobbies, or interests that you can actually achieve some amount of success and complete a task in, knowing that you're going to be back into doing whatever kind of caregiving you're doing tomorrow, really makes a difference, because we miss that if we don't have a lot of wins in a week or a month or a year.
Did you hear that, ladies and gentlemen? He mentioned about wins. You need to have some small little wins in your life. It doesn't have to be big wins. He mentioned about small little projects. So if you are a caregiver right now, find those small wins in your life. Walking outside, just getting that sunshine there, just enjoying those small wins. It doesn't have to be big. You know what they say how to eat an elephant? How do you eat an elephant?
One bite at a time.
Did you hear that? One bite at a time.
Right.
And same thing with caregiving. Same thing with whatever you're going through, anxiety, depression, whatever here. You gotta do it one bite at a time. Let me just turn off this phone call here. All right. See, we're live. So watching live, comment live, watching on a replay, comment replay. All right. So this is open house today. I just asked Ms. Ann, Dr. Ann and Aaron. So on the spot. So I just want to ask them, where can they reach you guys? Address and the telephone number?
Sure. So our address is 65 Murray Bar Drive, and we are here in Jackson, Tennessee. Our phone number is 731-300-0810. And our website is imindjackson.com. You can pretty much Google iMind, or you can look us up on.
All right. Again, thank you very much, Dr. Ann. Thank you very much, Aaron, for coming over on our show. We appreciate you. Again, check it out, iMind website. But before I let you go, always remember the word FAST. FAST, letter F. Find a therapist that will bring out the best in you. Find a therapist that will bring out the best in you. There are a lot of therapists out there, a lot of doctors out there. I personally know Miss Ann. She listens to her patients. She takes care of the patients. There are a lot of practitioners out there. They're just coming in and out. You got to find a therapist that will bring out the best in you, okay? Next letter is letter A, take action. All this stuff that we're doing, it's not going to do me good. It's not even going to do Miss Ann good or Aaron good if you don't take action. Take action by going here, go to the website, call their number. We're going to put up their number later. Take action, because imperfect action beats perfect in action. Like what Aaron said, small wins, ladies and gentlemen, okay? Next letter is letter S. Share and subscribe. Share and subscribe. If you see the iMind Facebook page, or whatever page, share. The more shares, the better, because it may not be applicable to you, but it could be applicable to someone else who's undergoing anxiety, PTSD, depression, Alzheimer's, or dementia, okay? And last but not least is letter T. Just teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, that's what they're doing here. They're teaching us how to move on forward to the acceptance stage, the more you actually understand it. Again, thank you very much. Check out iMind Wellness, health,
mental health and wellness.
Mental health and wellness. Check it out, Dr. Anna Cook and Aaron. Again, we appreciate you. Be awesome, be great, be excellent. And we'll see you later, my Facebook friends.